Thanks very much, and thanks for organizing another health forum. It's great to be part of this, and it's nice to be out and be able to talk healthcare. I usually am talking about transportation everywhere I go. I think it's very important that we're hearing what's going on in our local community. You know, we've been in government 9 months, and I think there's a lot of work, and you hear the stories tonight. It's not new problems; it's problems that are continually occurring, and I believe we're making progress to try to fix the system. It won't be a fix overnight. I think the best thing that we have done as a government in healthcare over the last 9 months was ensure that we followed through with the arbitration with the OMA and made peace with the doctors again. That has been lacking from a provincial government for 4 or 5 years. So I think that's the first step in making a fix into the healthcare system. This past budget, we announced the healthcare budget is increasing. We're putting more money into mental health and addictions, new money, increased funding into the community home care sector, and increased funding into our hospital system. At the same time, while we're transforming how community care is going to be delivered, a big announcement about removing the LHINs into a super agency and having community health teams created. The first will be up and running this year, and that should help coordinate the care, as was mentioned earlier, of all the lack of communication involved. This should hopefully start the communication process where your family doctor is actually integrated into the healthcare team, as is the case coordinator from what would be the LHIN now into the community, would be coordinating the care through the hospital. It would be more of an integrated care. So we will be transforming that over the next 3 years as we get fully up and running, but the first healthcare teams will be starting. I'm fortunate enough I get to sit beside the health minister, Christine Elliott, in question period, so I'm usually talking to her about healthcare and the issues that are ongoing. She's dedicated to continuing to invest in long-term care, build those beds, but to deal with the 4,000 patients that are ALC patients, they call them, those that are stuck in the hospital bed with nowhere to go. So I think by moving to improve community care, working on long-term care beds, we can move those folks out of the hospital to free up money for people that need to be in a hospital bed. So work is ongoing, and my office is always open for if you want to have a discussion. Delaney's been here taking notes for me from my office anyways, so I'll catch up on what I missed, and I look forward to hearing everything you have to say tonight. Thank you.